Let's be honest, going to the doctor can be a little overwhelming. You know something's wrong, but trying to find the exact words to describe how you feel, that can be a real challenge. So in this explainer, we're going to break down how to turn that stressful visit into a clear, productive conversation that actually gets you the help you need.
We have all been there. You're sitting in the exam room. The doctor walks in and asks, "So, what seems to be the problem?" And your mind just goes blank. Sound familiar? You are definitely not alone. And we're going to give you the tools and even the exact phrases to handle that moment with total confidence.
So think of this as our journey together, from start to finish. We'll start with that very first moment you feel sick, then we'll move on to how to talk about your symptoms, how to navigate the actual conversation, what to do when you get a diagnosis, and finally, how to walk away with a recovery plan that makes perfect sense.
Okay, so our journey doesn't actually start in the doctor's office. Nope, it starts at home. It's all about that very first moment you realize, something just isn't right, and you decide it's time to get some help. You know, it's rarely this big, sudden thing, right? It's a slow build. That nagging tiredness you just can't seem to shake, or a throat that feels just a little off. The key is recognizing those early signals. Step 1 is really just paying attention to your own body.
All right, now for what I think is the most important part of getting ready, turning that vague, I feel sick feeling into specific language that your doctor can actually work with. Let's look at a few powerful examples. See how powerful those descriptive words are? Instead of just saying, "I have a headache," calling it pounding and saying it won't quit, that paints a much, much clearer picture. It tells the doctor about the severity and the persistence of the pain. It's so much more useful. Now, what about something a little more general, like fatigue? Well, here's a pro tip. Adding a timeline is key. Using a simple word like lately is so helpful for a doctor. It immediately tells them this isn't just a one-day thing. It's an ongoing problem they need to look into. And check this out. Describing the sensation itself. You know, sore throat's good, but scratchy? That's even better. It gives the doctor a specific texture to think about. And when you start putting these phrases together, you give them a full, detailed story of what's going on. Okay, so you've done your homework, you've got your descriptions ready. How does this actually play out in the exam room? Let's walk through it. I know it sounds super simple, but starting with an honest line like this, it's perfect. It immediately sets the right tone, it cuts right to the chase, and lets the doctor know, okay, we're here because something is genuinely wrong. And then you'll see the doctor jump in. They're going to ask follow-up questions to dig a little deeper, to connect the dots. This is exactly why having those other symptoms ready to go is so important. Your answers are the clues they're looking for. And boom! This is where all that prep you did really pays off. By being ready with those secondary symptoms, you're linking that pounding headache to the fatigue and the scratchy throat. All of a sudden, the doctor has a complete symptom profile to work with, not just one isolated complaint. So, you've laid out all your clues, you've painted the picture for your doctor, now comes the diagnosis. But this part is all about making sure you really get what they're telling you. And there you have it. That's the diagnosis. See how that happened? The patient's clear, specific words, that pounding headache, the fatigue, the scratchy throat, it led the doctor right to a very probable cause. Your words are literally the most important diagnostic tool you have. But you know, sometimes symptoms can be a little tricky. They can overlap between different illnesses. For instance, the doctor might say sinus infection, but it's also helpful to know about related things, like the flu. Just knowing the official definition helps you spot those key differences, like fever and body aches. Okay, this chart is super helpful for telling things apart. Look at this. Sure, you might have a sore throat with a cold, but the big red flag for the flu, that's usually the fever and chills. And that pounding headache we keep talking about? It's a classic textbook sign of a sinus infection.
All right, so you've got the diagnosis. But that's really only half the battle, right? Now you need the game plan, a clear, actionable strategy to get you back on your feet. This is where we shift from explaining the problem to understanding the solution.
Seriously, this question right here, it's probably the most powerful tool you have at this point in the visit. You should never leave the doctor's office without asking it. It tells your doctor you need concrete instructions, not just a name for what you have. And in a perfect world, the answer you get looks something just like this, a super clear, step-by-step plan. The doctor's advice is broken down into 4 simple things to do: medicine for the infection, something for the pain, and then the 2 pillars of almost any recovery: plenty of fluids and lots of rest.
And a really crucial part of any plan is knowing when things aren't going right. Your doctor should give you some red flags to look out for. If your symptoms suddenly get worse, or if you have other risk factors, you need to know exactly when it's time to call them back or even seek more urgent care.
And before we wrap up, let's just zoom out for a second. We've been talking all about how to deal with being sick, but the best strategy? Well, it's always prevention. For something like the flu, getting vaccinated is hands down the most effective way to avoid having this whole conversation in the first place.
So I want to leave you with this question to think about. After everything we've talked about, what's that one thing you're going to do differently next time? Maybe you'll use a more descriptive word for your pain, or maybe you'll just make sure to ask, what should I do about it? Whatever it is, just remember, you're the most important person in the room when it comes to your health.